Hey guys, Dr. Luke Stringer here from Advanced Health Chiropractic down at South Loop in Chicago, and we're back talking about headaches. And a real common question we get asked all the time is, why does my headache start right at the base of my skull and then refer into my brain? And why do the muscles at the back of my skull always feel tight and sore? And it's a great question. We're going to know exactly what's causing that right now. So before we do that, let's go over what we expect to see within the spine, the joint and the tissue. So when you evaluate the spine as in alignment, we expect to see the ear be on top of the shoulder and a nice even curve within the spine. And when we see that, you create good loading into the joint and the tissue. And when you evaluate the tissue specifically under a biopsy, the tissue should look really structured and uniform. So essentially, we use this rubber band analogy, the tissue should look and function with a little bit of resting length on it. So when you function, the tissue can move within normal limits. However, when we have postural shifts from things like car accidents, or what we see a lot of here is repetitive stress, he's sitting essentially, then we have postural shifts, right? And what happens is the spine that should be in alignment shifts out of alignment. So what that does, it puts stress and tension onto a little muscle group that anchors your skull into these top two vertebrae called your suboccipitals. They sit below your occiput, which is the bottom part of your skull here. So when we have that postural shift, it puts stress and tension into the soft tissue. So essentially the tissue, instead of looking as we just went through it with a little bit of resting length on it, now looks like this. So over time, the more stress and tension you put into tissue, the tissue physically breaks down. It becomes weak and inflexible. When it becomes weak and inflexible, when you go to load the tissue, i.e. you're physically upright, and you're doing any form of neck movement, then the tissue simply can't handle what you're requiring it to do. It breaks down. You get sore, it gets puffy. So if you're suffering with headaches, your headache starts at the back of the head, it refers behind the eye, you get constant discomfort at the base of your skull, chances are your suboccipitals are damaged, and that needs to be addressed specifically with some treatment that we're going to go over in a later video. So if you're suffering with headaches, family member, co-worker, friend does, we encourage you to click on the button below, fill out the contact form, take care of the $39 offer. We look forward to seeing you in your office and going over how we can get your headaches corrected.